Hi, I'm Jeff Karamaris, and this is Rainbow River Medical. This is again Chantal DeBeja, our office manager. I don't know what week this is for us doing these, but we are offering the coronavirus testing still here in the office. It's been quite a busy week since we last spoke on film. Today, actually, the U.S. hit 1 million cases of coronavirus.
Yes, and tomorrow the death rate, not to scare anyone, Vietnam was a 19-plus year war. Tomorrow, with the rates we're going, we will hit that amount in the death toll of U.S. soldiers.
It's scary. It really is. It continues to be an evolving virus. There's more and more symptoms showing up every single day. We are seeing more of the loss of taste and smell. Seen quite a bit of that this week. So as of last week, we had how many? 29 positives last week, and we're well over 40 right now. I don't know the exact number. We've been doing this 5 days a week now, and then playing catch up the other 2 days a week. And we've been doing it for 5 or 6 weeks now total, and so the numbers are getting away from us a little bit, but it is over 40. We're still seeing almost just as many positives as we were on the previous weeks, and we're also seeing similar symptoms, but it's an ever-evolving virus. We still don't know if this is the type of virus that you build an immunity to and you don't get again, or if it's the type of virus that once you have been exposed to it, you carry the markers with you the rest of your life, and it could possibly be possibly come back again, flare up.
They test it via IgG cells.
Yes.
Which is in your immune system. You have, I want to say, 5 different ones, and then subtypes of each 5. Mm-hmm. Today we did a blood test on me to see if I carry that IgG cell, which means that either one, I've had it, or I could be immune to it.
Hello? Hi.
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 As you see, Jeff is no longer here. He had to step out to take care of a patient. You will see later in this clip me getting my blood drawn. That is for the IgG test to see if I carry the antibody for the COVID virus. We will be offering this very soon for our patients that come in here, as well as the COVID testing that we're doing now. This antibody test, one, will show if I've ever had it, if I'm immune to it, and the blood will also be able to help people with the vaccine if I have that antibody. They'll be able to use my plasma to give vaccines. We're in the midst of setting that up right now. It's all new. I can't guarantee that because you have the antibody you're gonna not ever get it. That's not the case. Many people have had shingles and or had chicken pox when they're younger, get shingles when they're older. This is all new, evolving. They just announced more symptoms of COVID, one including blood clots, young people dying of strokes because of blood clots. The death toll is drastically rising. Probably tomorrow or the next day, we're gonna reach the same amount of US soldiers that died in Vietnam during a 19 and a half years. And this is all within a matter of a few months. It's all new to us, but we're out here trying to do what we can for you. We're doing the testing daily. That has not slowed down. It's Monday through Thursday, 7 to 3, closed for lunch from noon to 1, as well as Friday from 7 to noon. Those results are getting back a lot quicker now. The tests that were done on Friday, we have already returned all those results to those people. As society opens up more, people are going to get symptoms. It's bound to happen as there's interaction. We're here for you. We'll remain here for you. We're breaking history here. She is actually performing the first antibody test here at Rainbow River Medical, which will be available to you. Flash, see, you got it. You're the best.
Hey. Years of experience.
Yeah.
More than years than you. Oh, so you're just gonna go slow on me today?
Yes, ma'am.
And you're gonna
I'm
drip.
dehydrated is why. But as long as we get enough to run this test, that's all that matters.
Yeah, I need a full one.
So what does this test actually do?
It's gonna test if I've ever had the COVID virus or if I'm immune to it.
That is gonna be the first step.
If it's an IgG positive, then that means you're immune. Your antibodies can be used for a vaccine.
Oh, that's even neater.
Yeah.
So we're gonna have to
We'll
have
follow
people
it.
donating and all that fun stuff, so we'll
They can
definitely.
already donate already through Blood One.
Mm-hmm.
Their plasma will be donated. We use the same plasma for people with autoimmune diseases such as CVID. It takes 180 donors for one infusion. We've given you all the negative things with COVID, the bad news. We do have some good news this week. We have our first official recovered case. She's been fighting this since early February. CDC wouldn't do the test because it wasn't from a hot spot. Even though we kept fighting them, saying the symptoms are there, we think it's that. As soon as we started the testing, we tested her and she tested positive. We tried one medication, she had a reaction to it, the one that they're telling us all to use. We tried another medication that has been clinical trials going on with it. Within 24 hours of starting that medicine, she said she felt normal. She has now had 2 consecutive negative tests, which, according to CDC guidelines, she's now recovered. So we do have good news. There is a recovery. Thank you.